been so much more fun if I could have brought my large, colorful parrot, Nikki, with me today. I am here and fortunate enough to be able to talk about Virginia Mason and our telehealth program. Virginia Mason, for those of you that don't know, is in Washington State. Most of our activity is in Seattle, where we are the smallest of 3 health systems, and we're the smallest by far, and that is going to matter in terms of what we've focused on, how we've stood up our program, what our objectives have been, and how we have been able to begin to compete in this market. Virginia Mason's been doing telehealth for over 20 years, predominantly in telestroke, with some smaller hospitals in the region. And of late, we've really began to look at this as a growth strategy. I'm the Senior Vice President of Strategy and Business Development for our system, and I'm talking about this really from the perspective of how we can continue to provide really superior patient experiences and retain our patients and referring providers, as well as try to grow our impact and influence. The pyramid that you see on this page is our strategic plan, and we use this all the time and all over the place. The most important part of this is the fact that the patient is very much at the top of the pyramid. This is the North Star for essentially everything that we do in our health system, and so telehealth needed to very much fit into this, as well as reflect our mission and vision, and quality is very much at the center of all that we do. We are a $1.5 billion health system with 2 hospital facilities. One, as I said, the larger one, Virginia Mason Medical Center, is in Seattle. The other is in Yakima. And in great weather, which happens sometimes truly in Washington State, it's about a 2.5-hour drive. In poor weather, you can't drive. So just connecting our 2 hospitals is one of the great uses of telehealth for us. We also have a number of regional medical centers, and as you've heard from other presenters, what we will sometimes do is have a telehealth visit in our regional medical center that comes back to a specialist at the hospital, because again, depending on traffic, time of day conditions, it can be a couple of hours, and people increasingly have no interest in doing that. So convenience is a big thing. Most people that are aware of Virginia Mason know about our quality awards. So we're very pleased with especially health grades. We're a top 50. We've made the top in Leapfrog every year that it's been in existence. And one of the things I'll touch on later is our recent and very intense commitment around the LGBTQ community. And telehealth has been a really great benefit for those patients. We are a little bit peculiar as a relatively small system in that 40% of our specialty referrals come from outside of our primary and secondary service area. And that's for a variety of reasons, but we get a ton of business from 5 states that surround us. We do have patients from all 50 states, but dominantly it's these 5. So again, trying to serve patients that would have to travel to us all the time makes telehealth something that's very appealing. Clearly, a lot of our patients still have to travel to us. That's just the reality. But we're looking at telehealth as a really wonderful tool that's going to save a lot of our patients and families time and money. Like many organizations, we have kind of 3 components. The first one, consumer, we do rely on a vendor. We do not have the ability yet to have all of our physicians providing 24/7 care to our patients and our employees. And this is modestly used. It's been kind of interesting to us, and I think it goes back to what we've heard in a number of presentations. Patients really want to connect with the providers that they already know and with whom they have a relationship. So this is important for us, but it's not where we're seeing most of the action. It's really much more in our own facility to facility and our referring providers who are very accustomed to our physicians visiting them and knowing them. We have a really active medical staff who has been very involved in growth. So each year we do over 200 visits to those WWAMI states. So these are providers that they see typically at least once or twice a year. And so the physicians in the community do feel like they've got relationships. These are people they know. It's not just somebody coming to them on a screen, and we've been told that that is one of our differentiators. Our two competitors in the market have robust telehealth programs. One of them is Swedish, and that's part of the Providence system. You know, Prov is very sophisticated. They're very innovative. They've got a lot going on, and so they are clearly a formidable competitor. Our other competitor is the University of Washington Health System, again, larger than we are. The benefit for us, kind of like our location, you have to sometimes make benefits out of challenges, is that we have been able to customize much more than our two competitors. And frankly, they don't have to. You know, they're big and they're successful and they can have more of a take it or leave it approach. We have benefited from working very closely with our companion providers and saying, what is it that you really need? What can we give you? Okay, it's these three specialties during these hours. That's great. We're happy to try to do that. So that has been a nice little bonus for us. And again, we're trying always to lower the cost of care for our patients, particularly where we can save them the burden of travel. Our objectives were really not very unusual, right? We want increased access points going back to our strategic goals. We are looking for sources of revenue, and we want to differentiate our service and make certain that we do continue to have the benefit of those referrals that we do count on. So we wanted to look at things a little bit differently and again, capitalize on our strengths. So one of the real emphasis that we've had these past couple of years has been in medication management. Virginia Mason has always had a very robust clinical pharmacist program. So it seemed like a great opportunity to look at that along with telehealth. We've had clinical pharmacists embedded in our primary care practices for quite a while. And it is not unusual, especially with our chronic disease patients and our chronic opioid patients, for their visits to alternate with physician one, then pharmacist, then physician, then pharmacist. So bringing the pharmacist visits into the home has done a few things. I think the most important of which you'll see on the bottom right of this screen. It actually allows our pharmacists to see inside the medicine cabinets and actually look at the bottles, because patients don't always remember to bring them. And they don't always understand that if they're using over-the-counter stuff, it's going to interact, and you know, we don't always invite them to bring in their NyQuil and all the other OTC stuff. So the ability to have someone take their phone and scan their medicine cabinet and have their family there weighing in saying, oh, and you sneak grapefruit juice sometimes, you know you're not supposed to, you know, it's been really, really helpful. In addition, it's a reimbursement opportunity. We've been doing this work forever on the telephone, but this is one of the areas that we actually can get paid for. The other program that I want to highlight in the minute or so I have left is the transgender community. We are in Seattle. Seattle's a very tolerant and lovely place. And we heard from our patients that we were one of the few places that transgender individuals really felt welcome. We also have transgender employees, we have transgender parents. And so this kind of came to us organically. That's a very tight-knit community with a lot of unique communication vehicles. And they showed up at Virginia Mason and said, thank you for making us feel welcome. And we thought, we're probably not doing enough if, you know, it's that simple. So we really focused, every one of our employees has gone through training. We've tried to be very sensitive to this community, and because these services are not available in many parts of the United States, it's a great opportunity for telehealth. Questions? Oh, I've got a couple nice things about our telehealth program. That's feedback from our patient surveys. No questions.
Any questions for?
It's always tough to be the one before the break, I know. Thank you.
Thank you so much.